Paving the road to tribal health. Reforms to improve access to the poorest in Andhra Pradesh. 7% of the population in Andhra Pradesh comprises of tribal groups. About 80% of the tribal population lives in the areas covered under the 9 Integrated Tribal Development Agency areas, also known as ITDA areas. The health status of these people inhabiting the ITDAs depicts a grim picture. Malnutrition affects a large proportion of tribal children and women. A very high proportion of the tribal population continues to be burdened with preventable and curable health conditions, including vaccine-preventable illnesses. All the ITDAs have high prevalence of endemic water and vector-borne diseases as well as TB. While Sitampet, Etur Nagaram, Bhadrachalam and Parvatipuram ITDAs are endemic malaria zones, the Utnur ITDA has been experiencing recurring waterborne diseases and fevers. On the other hand, the Chenchus of the Srisalem ITDA suffer from very high incidence of TB. Srikakulam, Adilabad and Vijayanagaram districts contribute heavily to maternal mortality. The IMR is relatively higher in the tribal districts of Adilabad, Srikakulam, Khammam and Vijayanagaram compared to the other districts. The summary results from District Level Health Survey DLHS 3 2007-8 depict that Adilabad, Srikakulam, Vijayanagaram and Vishakhapatnam reported less than 60% of institutional deliveries, while the state average was 72%. The full immunization rate for children between 12 to 23 months was less than 55% in these districts, while the state average was 67%. The Sentinel surveillance data suggests that the HIV positivity rate is relatively high among the pregnant women accessing ANC services in these areas. It is in this context that the DFID-funded AP Health Sector Reform Program APH-SRP has been implemented by the Department of Health, Medical and Family Welfare, Government of Andhra Pradesh, with an objective of improving health service delivery, especially in the underserved, tribal and remote areas largely inhabited by the poorest of the poor. The Government of Andhra Pradesh, with technical assistance from FHI, undertook a functional review to identify areas for strengthening service delivery in these tribal areas. This review looked at functional effectiveness in 3 important dimensions. For example, quantity, quality and access. The main purpose of the review was to look at specific issues relating to provision of infrastructure, human resources and technical inputs, maintenance of infrastructure and capacity building of key personnel, and generating demand for and utilization of public health services. The review was conducted in 2 phases. In Phase 1, an in-depth examination of public health facilities in Sitampet, Srisalem and Utnur was conducted. In Phase 2, the review examined the functional effectiveness of public health facilities in Paderu, Etur Nagaram, KR Puram, Rampachodavaram, Parvatipuram and Bhadrachalam ITDAs. In each ITDA, a representative sample of 25% public health facilities, for example, PHCs, 24/7 PHCs, upgraded PHCs and CHCs were selected for in-depth reviews. In addition, sample area, district headquarters and tertiary hospitals in close proximity to the ITDAs were also selected to be reviewed. the demand-side issues, perceptions of the patients with regard to access, quality of services and treatment were assessed on a sample of patients and attendants as well as community representatives. Major findings in all 9 ITDAs. There has been a rapid expansion of the primary health infrastructure in the tribal areas over the recent past. A large number of PHCs have been upgraded into 24/7 PHCs. In some scheduled areas, select sub-centers have been upgraded into PHCs. However, the upgraded facilities lack essential complementary facilities like residential quarters for medical officers and paramedical staff, water supply, telephone, generator, toilets and emergency vehicle. Another critical aspect was a significant number of MOs, paramedical staff and nursing staff posts were lying vacant. This was affecting service delivery in tribal areas for a long time. Most of the services were provided in the forenoon session. Many PHCs did not provide inpatient care due to lack of residential quarters, did not have second MO, or the MOs resided in distant places. Poor patient perception about the quality of care in these facilities. In addition, the ITDA facilities experienced a pronounced impact of systemic gaps pertaining to suboptimal financial management, underutilization of NRHM untied funds and Janani Suraksha Yojana, weak intersectoral coordination and functional disparities between the medical and tribal development structures. The functional review recommended the adoption of 3-pronged approach. Focus on intersectoral coordination to address broader determinant of health, strengthening of existing health services, and designing alternate models of service delivery through innovative approach to reach out to the needs of the poorest. Intersectoral coordination for preventive healthcare needs to be meticulously planned, which include coordination between district medical officers and health officers and ITDA, coordination with community-based organizations for cleaning of water sources, food security, and provision of double ration. Convergence is also required for road connectivity, drinking water supply, supplementary nutrition, antenatal and postnatal care, immunization, and health awareness. The coordination is particularly essential in areas affected by recurrent vector-borne and waterborne diseases. Education. Strengthening current delivery mechanism includes improving infrastructure in PHCs and sub-centers, reallocation of resources based on population size, strengthening monitoring and evaluation systems, financial and schemes management. Introducing alternate models of service delivery include public-private partnership for PHC management. Other examples are public-financed and privately provided services and outsourcing diagnostic and lab services. The government is totally committed to address the issues of the tribal population and the vulnerable section living in the region in order to improve the overall health indicators of the state in the long run. All the recommendations now form the foundation for a comprehensive tribal health policy to be implemented within the state with a revitalized zeal.